Welcome to the Homegrown Heart Podcast every Friday at 7 a.m. Mountain Standard Time with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and considered an expert in her field. This week's topic, guest interview with Karen Davidson and the overall experience of working in healthcare. Right now, help me welcome our host, Dr. Amanda Ryan.
Carlsbad and surrounding area. Today on our podcast, My Homegrown Heart, we have a very special guest, Karen Davidson. Good morning, Karen. And Karen is going to share with us some very moving experiences in healthcare in the last several years. I hope you enjoyed our PAD Awareness Month. Again, this week's episode was an actual patient interview, Mr. Raymond Franco. That was very good, very informative. I talked to one of my family members this week. Actually, I was telling Karen, my Aunt Debbie Chrysler. Hi, Aunt Deb. She told me that my great-grandmother, so her mother, actually had significant peripheral arterial disease and ended up with both legs amputated. And Deb has been a caregiver her entire life, and Deb took care of her, and she was telling me just how bad it really was. She'd also had open heart surgery for 2 valve replacements. So I wasn't aware of that with my great-grandmother. So it was interesting to hear that family history too. It's interesting how sometimes you just kind of feel called to something and there's a lot of different reasons. You don't always know them. But I was also happy to know that some of my distant family in Illinois are listening to the podcast. Again, if everyone could help me kind of spread the word, there's a lot of purpose of this, and it isn't about making Dr. Amanda Ryan known or anything like that. The goal of this podcast is to educate people, to motivate healthcare workers, and to really make a difference in Southeast New Mexico and further, kind of peeling back some of the layers in cardiovascular medicine, like getting people to just understand more. So Karen, tell me how you got into healthcare.
As a young adult / teen, my dad said there were 2 opportunities to go to college. You could be a nurse or you could be a teacher. And I didn't really like children that much. So I didn't think I wanted to be a teacher, especially, like a grade school teacher or something. So I was a nurse, and that's just the time I grew up in. My parents didn't have the money to send you to 4-year college, or they didn't feel like there was a way for you to go. So I became a nurse, and I because I had worked in a nursing home, I was drawn to the elderly population. So right out of nursing school, I became a director of nursing.
What was the care in nursing homes like when you started? And give us a time frame. This is late 70s. Sorry, people.
Yes, 80s really. I graduated from nursing school in 1981. So, care in nursing homes has always maybe gotten a bad reputation, but we always loved the patients for who they were when they came to us. But obviously, there's been a lot of advances in the care of elderly patients and in nursing home care. But, it is one of the most regulated industries in the country. And it should be, taking care of someone's precious elderly should be regulated, and it is. So I learned a lot through that, and then, became a consultant, and eventually became a chief nursing officer for multiple companies, but started with a Fortune 500 company and ended up living for 8 years on the East Coast.
Okay. And let's fast forward. It's a great career and you've learned so much. I think in the nursing home industry, what a lot of people might not realize either is that they were often on the cutting edge of technology, computer use, pharmacy, regulation, that kind of thing. Tell us a little bit about some of your experiences there.
Well, I was lucky enough to, when there's an assessment that you do in long-term care that's called the MDS, and when that first became a regulation, we looked for ways to be more efficient and not have to do it all by paper.
Mm-hmm.
So a company came to me and said, will you help us design? And of course I was like, I don't know anything about computers. I'm never going to use one. So I can write things faster than I can put it in a computer, which is probably still true today. But again, that's not the point of the computer. So I talked and they designed, and together we launched a pretty good, well, they launched it. I was just, I guess, some of the brains behind it, but we launched a great system that has been through a few evolutions, obviously, since then, but still around today. And that was exciting, and, you feel like you made a difference, in healthcare that way.
Definitely. How about, so fast forward, you do all these executive roles, you've always, I think the one thing that, as my mom, I've always admired about you is that you've always willing to quote unquote roll up your sleeves and help with any task in any facility. It wasn't that, corporate's here, we have to act a certain way or we can't. I never saw that with you. I've worked at a lot of your facilities over the years. I wasn't treated special, just so you all know, the same rules. But I think you always, the way I've talked about the state inspectors recently and federal inspectors and how I do think that they want to be more collaborative. I always felt in your corporate roles you were trying to collaborate with your local facilities, which you could have managed up to 500 at some times, which was quite a task. But how do you naturally feel compelled to connect with the people? And why is that an effective leadership style in your opinion?
Well, I just believe you don't do anything, or you don't ask other people to do anything that you're not willing to do. And at times you need to roll up your sleeves. I never wanted to be that person in the ivory tower. Although I didn't want to, pretend that I was too far removed from patient care or what really goes on with patients. And, I'm truly a nurse. My heart is with the patients.
Great. And I think there is a certain amount, I know Team Health is an organization that has a lot of hospitalists and ER physicians and anesthesiologists. I went to my MBA program with several of them. And they require even their top level physician executives to still do a couple shifts a month. Mm-hmm. And sometimes, me trying to balance now, you trying to, we're trying to balance the management of our practice and facilities with the clinical stuff, and it is a challenge. But I do think if you get to, especially in some of the situations you were in, where a corporate office was off, not by the facilities, in a totally separate place, I don't know if you can really stay connected to what's going on the ground if you never go.
Absolutely. I never had, this is the crazy thing, I was a chief nursing officer for many, many, many years, and I never had an office in a corporate office. My office was wherever I was. I ended up going to a lot of troubled facilities. Mm-hmm. But I never had an office in the bricks and sticks corporate office.
Yeah. And because you didn't really want one.
No. I just felt like that wasn't what my job was about. And, there's probably people today, as it's gotten more complex, that need that and want that. But that just wasn't where I was.
And you really were part of the development of quote-unquote corporate nursing in the long-term care sector. What did that really entail? Like your first corporate nurse position, what did you do?
I was like, more or less a super DON. You went to the different buildings and you helped them identify weaknesses and you helped them implement plans to make them better. But, I came from a pretty nice facility, and so I didn't have an idea always what to do with the struggles that some other buildings had. So you learned a lot.
Definitely. And you had a private owner that owned about 5 or 6 facilities in Central and Southern Illinois. That was your first start.
Yes.
And you kind of went around chart audits and schedule issues and that kind of stuff.
Yes. But, one of the things that's always been difficult in nursing and medicine is staffing. And so I can remember that one of the things that took me away from being a director of nursing and made me decide to be a consultant was I got a phone call in the middle of the night, and this young lady told me that she couldn't come to work because her boyfriend had gone into a rage and burned all her clothing, including her underwear. And I remember saying to her without even a thought, wear a pair of his. And then I hung up the phone. I thought, I can't do this. I can't make it. I can't let my job make me be somebody I'm not. I'm a caring individual, and I just answered that girl who may have been in distress, like I didn't care. So soon after that, I said, it's time for me to step away from the rigors of staffing.
Yeah, because 30 years of staffing problems. Yeah. Because I think we're very aware of the healthcare. Again, there's nothing but healthcare shortage that you read about, everywhere right now. Healthcare shortage. I think long-term care has been faced with it often. It's often not the preferred choice for a lot of people in healthcare like it was yours. And I think it takes a special person and passion. So oftentimes staffing has been an issue in long-term care, more so than maybe some of the other sectors. Now we're dealing with it everywhere.
Yes. I mean, no one in my nursing graduating class said, I hope to work in a nursing facility. They just didn't. Well, we all thought we wanted to be in the hospital. I myself said I was going to work in OB, never set foot in OB. But, I think that it's not the most glamorous.
Definitely. Well, even now, a lot of people, they want ER, they want ICU, they want, and the reason I think that, again, sometimes it's 312s, sometimes it's viewed as exciting or a quick chance to make a difference, but taking care of our most vulnerable population and our elderly or our very younger sick people that need a facility, I think is an underappreciated, importance.
Absolutely. Nobody wants to go to a nursing facility, but people need to sometimes.
Definitely. How about, let's fast forward to COVID. What was that experience really like, and how has it changed? What did it change in your perspective?
Well, I was in New Jersey when COVID came about, and unbeknownst to the rest of the world, we actually had some of the first cases in New Jersey, although we didn't know they were COVID-19. In the beginning, we called it the coronavirus,
Mm-hmm.
And if you look up coronavirus, it's one of the strands of COVID virus is a cause of the common cold. So as a leader, when I started hearing about it and reading about it, I'm reading about, we'll be fine. We know what to do, We had no idea of what it was going to become. So one of my first encounters with it is we had a visitor who had been in Europe or somewhere overseas and came back, and him and his wife came to the facility. His wife broke her hip. And he came every day to visit her. He got very close to the administrator. They would have coffee every day, trying to talk through it. And then soon after that, our administrator became very ill. And for 3 weeks, he went back and forth to the doctor. He had an upper respiratory, couldn't get rid of the chills, had fever, and eventually ended up on a ventilator and passed away at age 50. And we're like, something isn't right. And so we worked a lot with the state agencies and eventually figured out that we had COVID in the facility.
His wife got sick too?
Yes, his wife was sick, but
she was nursing, or she was?
Yes, she worked for me in one of my facilities, and now she was able to, come back to work eventually, but they went through this separately because, again, when you went to the hospital, no visitors, no anything, so she had to deal with losing him, and they couldn't be together.
And I was out here on the, in the Southwest, and we were hearing this stuff, it was all over the news. It was kind of February, end of January, beginning of February of 2020. And I think we were kind of, people who were not affected by it right then, I think we're thinking it was a little bit being overplayed or dramatized by the media. You don't know exactly reality versus, what's going on. So I know I called you, and you got sick yourself at one point, and so could you kind of tell?
Well, I remember Amanda calling me, and I said, it is as bad as you're hearing, only worse. We did have freezer trucks for, people that had expired and there was no place to put them. We did have no equipment. I remember we couldn't get a thermometer. You couldn't order one. You couldn't find one.
How about staff coming to work or being afraid or what?
There was just so much fear and misinformation that people just stopped coming to work. And, where for other industries that were forced to shut down and all that, it was great that each state was able to pay more, for unemployment and that. But for healthcare workers, that was not a blessing. I mean, I'm sure for people that had to stay home with their children and stuff like that, it was a blessing. But from where I sat, it was not a blessing. I had people who said, I could stay home, not be exposed to this, and make more than I can coming to work. So I can remember many days that there were myself and maybe one other nurse for 80 patients. I long took off my suit and heels and became a nurse again.
What kind of hours were you working?
I would go to work at 6 a.m. and come home at midnight. And sometimes we'd just stay in the facilities because there was no one really overnight.
What did you eat? What happened to your fitness journey?
Oh, well, of course my gym closed, so you couldn't go to the gym anymore. But also, because of people felt helpless, families, vendors, everybody felt helpless. They weren't going to come to your building, but they said pizza. I, to this day, cannot eat pizza because that's all we ate was pizza or whatever restaurant happened to still be open. I mean, I was in a very populous area of New Jersey, but restaurants weren't open.
Some of them weren't. So you worked about 6 months straight, almost without a day off, would you say?
Yes, I parked my home base is in Illinois. I parked my car on I'll never forget it. It was February 2nd, and I picked it up on July 5th.
And normally you went home about every 2 weeks, you'd say, or 3 weeks?
Oh, yes. I had an apartment in New Jersey, but I still went home, routinely. I had a nephew that was playing high school football, and, my granddaughters were there. So, yes, I went home routinely, but I think however long that is, I didn't go home that whole time.
And did you work every day?
Every day. I think at one point we said it was 128 days in a row without a day off.
And you didn't have housekeeping staff? I mean, nobody?
No. I mean, anyone that wasn't directly involved with patient care was encouraged, really, to stay home. But, as long as you have a building full of patients, you still need to clean the facility. You still need to feed the patients. So,
and there's a little bit of, I felt a survival of the fittest attitude, kind of this it's killing the older sick people, etc. And I think even, you had some very high-end, fast turnover facilities that were really rehab facilities that patients might stay an average of 2 to 3 weeks post major hip surgery, knee surgery, cardiac surgeries. So you did not have everybody in your facility that was quote unquote within the last 6 months of their life, would you say?
Oh, no, by no means. I can remember I was sitting in a room with a patient who came to us from the hospital after a lung procedure, 39 years old. And he said, oh, excuse me, I need to go to the restroom. He walked to the restroom, he walked out, fell on the floor, and he was gone from a pulmonary embolus, which we later found out was another side effect of COVID.
Yes, which we had ended up hitting out here about March, more that time, and just crazy what really even we experienced as far as the volume overload, the acuity of patients. And then I remember we had one patient, we had called 23 states to get a patient transferred, considering VA ECMO and some, very advanced therapies on that patient. and we could not find somewhere to transfer the patient literally in 23 states.
Well,
And it wasn't beds, it was staff a lot.
Yes.
You know, people would say, there's no beds. No, there's no staff for the beds.
right. There was just such fear and fear of the unknown. You know, I can remember our first real diagnosis of COVID-19. We called the state and they said, well, you know, wear surgical masks. We looked at each other. Now, remember, in my day of nursing, the people that wore surgical masks were the surgeons. That's why they're called surgical masks. So we looked at each other and we're like, well, we have 4 surgical masks in the entire building. Who's going to wear them? And I remember talking to the state epidemiologist and I said, what's the best way to attack? He goes, well, I would put the mask on your sickest patients because they are who are spreading, you know, the virus. If you're exposed, you're already exposed. But he said, I would put them on your sickest patients. In that facility, I believe we had 81 patients and we lost 31. I remember looking out the window one dreary March day. I know that sounds like the beginning of a horror book, but it was. And there were 8 ambulances lined up waiting to take patients.
It's just, if you could get one, because there were
Yeah.
times you couldn't.
Our hospitals went on shelter in place. They wouldn't take our patients. They said, you know, and if you called 911 and you said the patient wasn't breathing, they weren't coming.
Yeah, the EMS providers in New Jersey and New York, I think, were empowered and unfortunately had to be put in a position where they said if they were not going to try to resuscitate somebody.
Yes.
So
There was such
whether
fear.
you had a quote-unquote DNR or not, if they did not think you could make it, they were not taking you. Is that your perception?
Yes, there was such fear about, you know, if I touch them, I'm infected, you know. We didn't know.
It was just a lot. Well, fast forward a little bit. So amazing you made it through that. Do you think there will be the next COVID-19?
Unfortunately, I do. I hope we learned enough from this, but sometimes I doubt that we really did. I mean, it's not that unusual for a virus to mutate. I think basic science, we all know that. So what is the next mutating virus? None of us can
They're
predict.
all out there and they're mutating. Same with the flu vaccine. I used to not have a good understanding of it. And people say, well, I got the vaccine, flu vaccine, I still got the flu. Yes, because we mass produce vaccines that are against the flu virus, most strands of this year for next year, because that's the only way you can mass produce it. We know that virus mutates so quickly, has simple RNA, and it mutates so quickly that by the time next year comes around, maybe only shares half the RNA with the vaccine that I received. So I'm somewhat protected, but I'm not fully protected. But what I often tell people after being several years of I'm not getting the flu vaccine, I've never had the flu as an adult. I had the flu as an adult where I thought I might die, and I continued to treat patients in an emergency scenario because I had to. I decided to start taking the flu vaccine, realizing that maybe you will still get the flu, but hopefully you won't die from it or have such a significant illness. So I think it's just understanding stuff. We will be exposed to and again, staying far away from the politics of it all, of the vaccine, of COVID but we will have the next virus that we haven't been exposed to in humans, and which is what creates a pandemic, epidemic, and so again, I wish as healthcare people, instead of politicizing it or getting pulled into that we focused on the science and the humanity of it all to figure out what are we going to do the next time.
Well, let's prepare our healthcare workers for the fear, the unknown, but also teach what our responses should be. I feel like our responses to COVID were reactions, not responses. We reacted to this, we reacted to that, but we should have had a plan. At some point, somebody should have stepped away from the politics and said, what's the plan?
Well, again, I often use HIV as an example, which, I was an original HIV educator with the American Red Cross years ago, and I used to go around spreading knowledge and information, and HIV could have really wiped out much of the world's population, and did much of sub-Saharan Africa and other remote places. But I do feel like we banded together as quickly as possible with scientists all over the world, really trying to figure out what was the best approach. We couldn't find an effective vaccine, quote unquote, fast enough, but we did find some very effective medication options, even though it was kind of a rapidly mutating virus. So I think, again, it's collaboration, which we talk about in all of our practices, in our foundation, collaboration with the patient, collaboration with each other. So I think learning to collaborate, remembering in healthcare what the goal is. So you switch. So then I think you were kind of burned. The first time in my life I ever saw you, working 13, 14 hours a day, 6 days a week was probably your average for a long time. Even though you had time to make cookies and stuff. My sisters are going to see this, okay, girls? All right, but even making cookies, I did tell someone yesterday, I don't know, my mom slept 4 or 5 hours a night. She braided our hair. She went to every event. She worked 2 jobs, and her house was always spotless. I don't know how. I have the work gene. I do not have the spotless house gene. I want it spotless, but I do not want to be the one to do it. It's not because I think I'm too good or I don't have any energy for it. And the 2 free hours a week I have, I don't want to spend cleaning my house. I mean, that's just reality. And I do need to, I'm better if I sleep 7 or 8 hours a night. I'll go to bed at 9 or 10, get up at 5 or 6. I think you can go to bed at 11, get up at 4, go to bed at 12, get up at 5. I just have a hard time doing that. But I did see you do that my whole life. And there's a lot of things you did that I wanted to emulate. The 4 hours of sleep has never really been one of them. So you are an amazing person for lots of reasons.
But I just wanted to say one thing that I remember during the whole COVID-19 thing is I worked very closely with a long-term friend of mine, and she had always had a desire to, when you look back on your career, she always said, I wish I would have served my country in the military. And one day, especially hard day, we'd lost a lot of patients or whatever, she looked over at me and she's like, this is wartime medicine. We've served.
Yeah, I think totally.
It just was I encourage people to, listen when the public service announcements came. We were glued to the TV. There was a governor at the time, or a governor at the time, who was on TV in New Jersey and New York every day. We looked forward to hearing the updates because, it was always when the charts peak, then the numbers will start to go down. We couldn't wait for the peak.
Yeah.
It was a very, very rough time for lots of people.
And misinformation is major. So when you felt like, I felt like those press conferences, you were getting facts. You need to stick to facts, not, the facts as best we had them. So,
and, the experts in the field, we were lucky to have, physicians in Columbia and some of the bigger hospitals in New York who were right involved in, research. So we were lucky to have some information coming.
Data analysis. I mean, they were trying to analyze data. It was happening so fast.
But COVID definitely was an illness of cities because of how closely people are together.
Urban more.
Yes.
So, how did you become Mama K then? I do think COVID led to some burnout, and
yes.
What were you thinking?
I was, I was getting close to a time where I thought maybe I would retire and just work part-time or something, and so I happened to mention that to said doctor next to me, who said, oh, well, you could come for a visit, help us out, do a few things, and like many people, I had the misconception, well, how hard can it be to work in a physician's office? Ooh. First of all, Dr. Ryan does not have just a physician's office. It's a very busy practice and just a lot of parts, moving parts. And so I came out with the idea that I would help for a little while, and I was going to learn every job in the building. So whatever Dr. Ryan needed me to do, I would be available to do. So, I thought I'd start with the easiest job. So I went to the front desk. It's not the easiest job.
No.
The front office drives the rest of the practice. And, phones, insurance issues, upset patients, sick patients, happy patients, whatever, the day might bring. It's a complex physician's office. But I believe probably most physicians' offices are that way. The front desk, although it might look like a simple job, it is not a simple job.
Totally.
I had a vendor tell me one day that we get as many phone calls in our office because they were monitoring our phone system. We get as many calls as one of the large hospitals in this area on a daily basis. Now, we're a physician's practice, and we were getting as many phone calls. And obviously, it's always an area, and we'll continue to struggle with phone answering. There's not enough people and not enough chairs for them to sit in to answer the phone every time it rings at our office.
No, sometimes I've had people say, well, do you need help answering the phone? I can put 20 people up there, and there'd be times where I wouldn't have enough people to answer the phone. And it isn't just about, actually a lot of physicians, my former partner in Florida has outsourced his phone answering at his facility to India. Which people don't like that either, but the reality is sometimes you just get such a volume. I will say one overwhelming thing we're really trying to do is utilize our portal. You've got to think outside the box in rural healthcare. You cannot, again, an average cardiology practice has 1,700 to 2,000 active patients. We have 10,000 plus registered patients. We probably have 6,000 active patients. So if we are managing 3 to 4 times, and again, and there's a shortage of 1 to 10 specialists and 1 to 20 probably primary care physicians in these rural areas, we've got to think outside the box of how we're going to care for the patients. So the traditional, I just call and get my refill, sometimes that just isn't going to work. And I know change is hard, but we have got to be adaptable. But not just as a practice, not just at the patients, you guys have to be adaptable too. You have to utilize, you've got to understand that sometimes you will see the nurse practitioner, that sometimes these remote telehealth programs where you can get on and go over with the nurse your blood pressures, your weights, we've got to use these things. Everybody can't, there's one Dr. Ryan and 6,000 to 10,000 patients, plus calls, plus emergencies. There's just a lot going on. So we've got to work as a team, and I think
COVID brought some good things in that they did teach us that we can do some things remotely. I think you've already focused on our remote team, but we have to be able to do some things remotely, and we have to look for efficiencies.
Definitely.
Because the number, as we know, the population grew. I think we're calling this time the baby boomers, but there's a large population that are aging right now.
And of physicians that are retiring. Also the most physicians are in that age range too. We cannot produce enough young nurses, young technologists, young physicians to really make up for what we're going to lose. So healthcare is in crisis, but we have to quit just saying it and responding as best we can. Let's prepare, let's get creative. Again, I talked about Herndon Memorial and Houston's healthcare high school, and we have to think of some creative ways. We can't just keep saying it. What are we, Karen, we're going to attend Becker's ASC annual review in Chicago. What are we hoping to accomplish? We're panelists there, we're speakers. What are we hoping to accomplish?
I think grassroots, making relationship with others. How are they handling what they handle? I mean, a big urban center can still teach us something because we're a smaller rural center, but we can learn how they're handling their huge caseload and see if we can adopt any of those practices. We have to be open to efficiencies.
Definitely.
It's no longer, if you have a task to do, you put a person in the task. You couldn't build a big enough building. And I worked for some very shrewd business people through my career, and I used to hear all the time, offices don't make us money. People oftentimes, the management in a nursing facility, their office is a closet. It used to be a broom closet because they don't build facilities for offices.
Right. There's a lot of cross training, you can't just be task. There's not enough people for every task. So in our practice, you have 20 or 30 tasks if you're part of the management.
And some you never thought you'd do. I mean, I don't think I ever really answered the question about Mama Kay. So when I came out here, obviously, Dr. Ryan and I favor. You can tell we're related. So people, the first question I would get is, are you Dr. Ryan's aunt? No, I'm her mom. And so, that kind of grew to Mama Kay. And I think probably I have that nurturing personality. Dr. Ryan has some younger staff and has had. And, you take on that role of being the old girl in the group. So, I kind of became Mama Kay. We have a gentleman in our team who's very witty, and he named me Mama Kay. And then my husband's name is Jerry, and he became Papa J.
And they're amazing, and we're lucky to have them out here in Carlsbad and as part of our practice. So there are not enough thank yous, Mom, for what you really are sacrificing. There's a lot she could be doing that isn't out here making a difference in the lives of the people of Southeast New Mexico and our staff, and I just want you to know that I really appreciate it.
Well, and I appreciate, at this point in my career, not many people get the opportunity to do something totally different. So from the front office, I also grew to, the cath lab, PACU, and when we were first talking about opening, it never seems real until you really do it. And I was like, I'll work in the pre and post-op. I can handle that. I like the patients, I've never really been high on the technical skills that go with nursing. I've always been more bedside or, theory or really sitting in the supervisor role. So I said, well, I'll work in PACU. And then it became, well, do you want to learn the cath lab too? And I was like, well, not that much, but I'll attend some trainings. I'll get my feet wet. And then it was like, yeah, you're in the cath lab today. Okay.
See one, do one, teach one. We've got an extensive training program, but we definitely teach people.
But definitely a different type of nursing than I ever did. But, it's nice to be my age and not stop learning.
I think that's you're not old, but always keep learning. There was a neurologist during COVID, 101, and he kept going to work and doing consults and stuff. And he's like, you got to keep your mind fresh. I'm a neurologist, been one for a long time. COVID is affecting a lot of people's neuro system, and I feel like I have something to add to the situation. So I'm still talking to patients. He really practiced routinely until he was 81. And he said, he would still do some consults at that age. I think he passed away recently. And he said, this traditional be 65 and retire, 55 and retire, 60 and retire is really went to the wayside for a lot of people. I think it depends on, obviously financially, it's expensive to live no matter what is the scenario. But the other question is, if you've taken good care of yourself and you're fortunate enough to have your health and your mind, I really do think that it's better to keep yourself busy and active. You may not want to do the career that you've done for 40 years. Sometimes a change is helpful. But I think there's a lot that people can contribute to society and the younger people that are, learning under them.
And I think when you're in healthcare because you want to give back for the most part. That may change how you give back, but you don't ever want to lose that. And, if I retire tomorrow, I want to do the things that I've always wanted to do, but, you also don't want to lose the side that you feel like you're giving back to people.
I agree. Thank you, Karen. It was wonderful to
Thanks
have
for
you.
having me.
Yep, it was wonderful to have you in the studio. I'm lucky to have Karen Davidson as my mom and my mentor. And I'm looking forward to talking to you next week. Have a great week.